Movement is a medicine for creating change in person's physical, emotional, and mental state. And following that, I, Himanshi Kaushik, your host of the day, would like to welcome you all in today's webinar on role of physiotherapy in stroke rehabilitation. So I hope that you are safe, sound, happy, and healthy at wherever you're taking this webinar from. So before we move on and learn about the motivation and the movements through physiotherapy in our session today, we have our expert here with us. So I shall introduce you to our expert. We have Dr. Manju Devi ma'am, an assistant professor, Department of Physiotherapy, Lovely Professional University, here with us. She is a postgraduate in Masters of Physiotherapy program with specialization in neurology and has experience of over 6 years in teaching. She is a magnetic personality and secured gold medal in her graduation and is guiding many masters and PhD students as well. She herself has published research papers in Scopus and has published patents, book chapters, copyrights under her name. Along with this, she has a clinical experience of handling patients in Fortis Hospital as well. So, ma'am, it is a pleasure for us to be here in the webinar and looking forward for an amazing session. And ma'am, before we continue with the main session today, I'd like to inform all the attendees that you can post in your questions in the Q&A box or chat box, or you can directly have a talk with our expert with your queries. So you simply need to just write in down your questions, and the questions of worth will be selected for our expert as well. Then you can talk to our expert. And now I'd like to request Manju ma'am to please take over. Ma'am, over to you.
All right, so thank you so much. I'm very humbled and honored to be a part of this webinar. The name of this webinar, as you all know, that is Role of Physiotherapy in the Stroke Rehabilitation. So I can see many of my students also, maybe undergraduate students, those who have done their undergraduations, so they have joined. So very welcome to all of you. Along with this, I'm very much honored that Division of Admissions has also given me the opportunity to be a part of this webinar. I think it is very timely and it is necessary that we address some of the world health issues. And even I'm more delighted that this webinar basically is about the stroke rehabilitation, which is also my area of interest, right? As I think we all can see, we can recommend the patients with the medical as well as the surgical technologies. We can recommend them very easily. But especially those who have done the undergraduations and maybe those who are seeking for admissions in Department of Physiotherapy. So for them, I would like to tell them that rehabilitation is the only you can say the profession, or the physiotherapy is the only profession which is helping beyond to the medical and the surgical expertise or the technologies. How this particular physiotherapy is working in this? After the medical and the surgical interventions, we know the patients will always left with some significant disabilities, right? So the patients are still having a disabilities after having a medical and a surgical interventions, and those disabilities are leading to the quality of life. I mean, they're hampering to the quality of life of a person. So what about that afterlife, when the person is having the difficulty in returning back to the scenario where he was before the stroke? Okay, so there comes the role of a physiotherapist, where we people, I think many of us, those who have joined, so we people are working in the area where we can improve the quality of life of such patients, right? So even I'm more glad that rehabilitation is now being included in a major world concerns. So similarly, we people have saw in the COVID time period, the physiotherapy has been recognized a lot, right? So even after the discharge from the hospitals, patients were having the issues, not only the lung infections, they were also having the issues which were related to their psychological or the cognitive levels. So we as a therapist are working on the psychological and cognitive aspects of the patients as well, along with the physiotherapy, right? So I think this session is before, I mean, in the initial time, this session is more of a one-way discussion, I guess, but I believe in a two-way discussions more. So I am expecting certain questions at the end of this sessions, right? So before starting this, I'll give you an outline. Just a minute. So the outline in this particular lecture, which we are going to talk, that is, I'll give you a brief idea about introduction. Then we'll have a talk about prevalence, about the stroke patients. Then we'll talk about the present and the future requirement for physiotherapists, why there is a need for the physiotherapist, that we will have a discussion. Next, we will talk about the concepts of planning and effective therapy protocol. We know this is going to be the protocol for so-and-so patient, but how it is going to be effective, that we will be having a discussion, like at what time period the physiotherapy should be encountered, should be incorporated into the protocol of a patient. Later on, I'll be discussing about standardized assessments. So we know there are a lot many outcome measures, like tools through which we can assess whether the patient has improved or not. So there are certain standardized assessment protocols. So I'll give you idea about those standardized assessment protocols. And later on, we will talk about the recovery prediction algorithm. So recovery prediction algorithm has been developed for the patients, where certain neuroscientists, you can say, those who have said such and such recovery will be there step after the step. Apart from this, the most focused area which I'm going to talk, that is the evidence-based intervention in the acute phase as well as in the chronic phase. So I hope everyone know that stroke is a very vast topic, or a very vast condition which cannot be recovered so quickly, and it cannot be explained so quickly, I guess so, right? So this lecture is just going to be an outline of all the interventions on the basis of their evidences. Okay, so it will not be so much into detail, but yes, a little bit outline of everything will be given in this particular lecture. So those who are not in a stream of a physiotherapy, for them, I guess these initial slides are. So here I'm talking about what actually a stroke is. So we people are talking about a stroke. So stroke is one of a medical condition where we know it will lead to because of the decrease in the blood supply to your brain area. So when you are having a less blood supply to the brain, then it will lead to a brain attack. So in a scientific language, we are calling it as a stroke. Now, this problem, when you are not getting blood supply to any specific part of your brain, it will lead to neurological impairments. And those neurological impairments, we mean to say that it is going to impact to any one side of your body or any part of your body. It may be a face, it may be a arm, it may be a leg of the patient. Okay. And in a layman language, we are calling it as a paralysis. So we used to say the person has paralyzed. So that is the condition which we are talking right now. So if you have idea, we are having a ischemic strokes, we are having a hemorrhagic strokes also. Ischemic is the one when someone's cerebral arteries which are supplying to your brain, the pipes or the arteries which are supplying to your brain, that is blocked. That is your ischemic stroke, which is 80% of the stroke. Apart from that, if you can look at the other side of the screen, you can find the hemorrhagic strokes, and the hemorrhagic strokes are the one where there is going to be a rupture because of increase in the pressure in the brain. So there will be a rupturing of the vessels that will lead to hemorrhagic stroke. Proceeding further, we are having certain risk factors. So just an outline on the basis of the global burden 2019, which they have given. So we are having a lot of risk factors for it. For example, there are metabolical risk factors, like someone is suffering with the cholesterol issues, high cholesterol, someone is having glomerular filtration rate is the issue, some kidney problems are there. Everything is going to have an impact on your brain. Okay, ultimately leading to a brain attack in a person. Second, if I'll go further, you can look at the second part, which is the behavior factor. If someone is smoking, someone is doing a more dieting also, it is going to have an impact on the neurons of a person. So neurons are going to be damaged even with your change in the lifestyle, which you think is a better one. So you are reducing your food habits, or maybe you are just decreasing it. You're decreasing just your minerals and the nutrients. That is also going to have an impact on the nutrition. Third one, which is a very broadly given, is your systolic blood pressure. So if someone's blood pressure is extremely fluctuating, that may also lead to stroke. And apart from that, there are other conditions. For example, we are having a lot many modifiable and not modifiable risk factors are there. So overall, if I'll say, there are 87% of the 87% risk factors are leading to a stroke burdens in the society. So you just look at the number is 87, it's not even 50. So the number is 87. It means the patients are going to be extreme in the coming few years. Right now also, I guess the patients are a lot. So in the coming, maybe not even a 10 years, within a 5 years, you will see lot many patients. Every sixth person is going to have a problem related to a stroke. It may be a young stroke, it may be an old stroke, I mean a elderly stroke. Okay. So now I'm talking next about the prevalence. So I'm giving a very quick ideas about the basics. The prevalence, if you can see, it's 110 million on a very first side. If you can see, 110 million people are experiencing the stroke. Okay. And out of that, if I'll talk about US, people are having around 6,10,000 strokes patient every year. So every year, this number is keep on adding. Okay. And the third column I have made for India, I have looked at the evidence, and where I found that India is also having, out of this 110 million, 7.4%, which is definitely going to be a huge population, who is also suffering with the stroke. And I just concised now this prevalence, and I tried to find more articles related to our area. So I identified that around 900 strokes have been identified every year in the PGI hospital, Chandigarh. I hope people, those who are listening to me, they are familiar with this hospital. It's one of the renowned hospitals in Chandigarh. So in the PGI, 900 patients per year they are addressing, and so kind of interventions might be there giving to the patients. And every few seconds, let's say just a 40 second, in United States, every one person is suffering with a stroke within just a 40 second of time period. So it means the you can just calculate, or it's beyond our calculation, maybe the number of people those might be dying, or those who are suffering with the stroke. So definitely there is a role of a physiotherapist in a coming era. So the future is in the hand of a physiotherapist, because we know, as I said earlier, there is going to be a disability after even the medical and the surgical interventions. So we will be having some disability that we need to encounter. So who will be encountering it will be the physiotherapist over here. Okay, this is again some of the basic information which I'm trying to give over here. So what happened during the brain injury? So when the brain injury will be there, if you can look at this MRI scan, which I'm showing here, there is an infarct. This infarct is the area where there is no supply to the brain. And ultimately, it will look for the surrounding areas for the adjustments, right? So that chaos is created. In a very layman language, we can use the word chaos is created, which is called as diastasis. Okay. And after some time, there will be a recovery phase. Okay. So the recovery is going to happen from the adjacent neurons. And later on, there will be a phase which is called as neuroplasticity. Automatically, there will be recovering of that particular area. But now it varies whether that recovery which is happening is right way or it is happening in a wrong way. So there comes the role of a physiotherapist once again. I hope everyone is able to understand what I'm saying. I'm just giving you a very brief outline about the basics. Now I tried to correlate my previous slide with the help of the global communication system. So, you know, if you are giving a phone call maybe to abroad or to your friends or the relatives anywhere in the world, and suddenly there is a disconnection of all the telephonic calls, just imagine. Okay, so what happened? There will be a chaos, like you cannot contact your near ones, you cannot contact your relatives, friends, family member, brother, sister, and so on, right? So there will be a chaos. That is the stage called as diastasis. Okay, later on you try to identify maybe a WhatsApp, you try to identify some other applications which may give you a contact. You can contact to your so and so person with the thing, right? And it is called as the starting of your wiring connections. You are trying to wire. Similarly, in your brain, you are trying to get a support from the other neurons, like you are taking a help of other applications to give a phone call to your dear ones. Later on, you will identify, okay, there are 4-5 applications. Out of this 4-5 application, this application is the best one, which is okay for me. I can contact my brother, to my sister with this number and or through this application. And you will keep on practicing and understanding which one is better. Similarly, in the physiotherapy, we are doing a practice again and again, and so that we can reach to a stage where our patients can reach a stage of efficient recovery. Okay, and where you are satisfied, your patient is satisfied. And if I talk in terms of a global communication, you are satisfied, like, okay, this is the better phone call, or this is the better application which I can use. So likewise, I try to connect it. So there will be a chaos, then you try to take a help from the other neurons, then there will be a practice of it. You will do a lot of practice using the physiotherapy here, and then you will establish a new connections here. Now, this is all about basics. Now I would like to talk. All right, so there is a poll also on your screens. I guess you can answer for the same. So now there is a agreed definition of rehabilitation. I would like to stress on this particular slide, especially for those who are seeking for master's program, or those who have already done the undergraduation. I think you can understand me more better. So what is rehabilitation? Even those who are seeking for bachelor's program, you should know about this topic, rehabilitation. So basically, rehabilitation is a process of active change by a person who has become disabled, and that person is going to acquire the knowledge and skills. So please keep in mind, as a physiotherapist, we are not only giving the skills to our patients, we are also giving the knowledge to our patient, okay, in a term of physical, psychological, and social functions. Okay, so it's not only the physical rehabilitation, like we are just doing the movements and we are just teaching the movements. It is also the psychological and the social well-being of a person where we people are dealing. Okay, and this reference I have taken from British Society of Rehabilitation Medicine. Now, the important thing here to understand here is recovery stage. So in the recovery, I have given you 3 highlights. The first one is called as behavior restitution or true recovery. So there will be a stage when your patient will recover to the same level as he was before the problem. So there was a brain attack. So now the patient is having a problem. You are giving the intervention so that the motor control will be improved, and the patient is reaching to the stage where he was before the stroke. So he's now returning to the normal. That is called as, that patient is considered as a behavioral restitution or true recovery stage of the patient. Okay. The second one is called as compensation phase. So in the compensation phase, as the name is explaining very well, it is a self-explanatory word, I guess, and it is telling you have to take interventions. You have to take so and so interventions with some substitutions and some maybe some cues or some tricks you are using. You are using some compensatory methods to achieve that motor control so that you can do the movements, right? Third stage, which I have mentioned over here, that is called as the spontaneous biological recovery stage. So this stage, spontaneous means something which is automatically happening, right? So means sometimes you don't need to give anything to the patient in a specific time period, and you will find that there is a biological recovery. Automatically the recovery is happening in a patient. Okay, but that time period is a very, you can say, a sensitive window, and being a physiotherapist, you should know that sensitive window, because that will tapers very early, means it will stop at a certain point very soon. So this is the very you can say a sensitive window where we should deal, or the patient should come to us. And unfortunately, sorry, but unfortunately, many of the medical professionals, they are not sending the patient to the physiotherapist at this point of time. If you get the patient in the spontaneous biological recovery phase, I think you can do the wonders with the patient. And I do have experience with the patients. When the patients luckily reached to me or approached me in this particular phase, and we worked on them, and they were so cooperative, and today we can see a lot of changes in their lifestyles. So this proper spontaneous biological recovery phase, I would try to explain. It's a very beautiful word, I guess so, and I'll try to explain with the help of a beautiful graph, which is given in one of a paper. So I'll just proceed with it. Okay, so this is the graph which might be you have seen earlier, or maybe you read somewhere. But I'll try to give you a more understanding about this particular graph. This graph is about the post-stroke recovery. Okay, so in the post-stroke recovery, there is a very first phase when someone suffered with the attack of a brain, when the blood supply is not reaching to the brain, and suddenly there is a that brain attack is there, and patient will reach to a stage which is called as hyperacute stage, which is from 0 to 24 hours, means within a first day. Okay, now this is the phase when the patient will be having a neurons damage, there will be a hematoma expansion, so it is keep on expanding, so which may leads to increase in pressure of your brain, intracranial pressure also. Okay, and later on you can see a blue color line which is showing you inflammation and scarring. So this will be from day one, from 0 day onwards till exceeding till maybe you can approx idea is 8 day. So it is reaching to that phase. Okay, now along with it, just have a look at the green line which is showing you the endogenous plasticity, and you can say the neuroplasticity, and the orange line which is representing the improving impairments and function. Okay, so these are the two lines which are shown in this particular evidence which I have taken from Stroke Recovery and Rehabilitation Roundtable Task Force. In this paper, they have done a research and they have identified that this orange color line, which is starting from from where, from a maybe a 1 day onwards to 7 day time period, and this is the this you can say is the very critical time period which we are saying as a spontaneous recovery. So the patient will automatically start the recovery at this particular point of period, but as I said, it is a tapered window, it is a very time sensitive window, it may stop at any point of time, although I'm showing here as a long run for a later time period, but it may stop in different patients and a different time period. So this is the right time, orange line starting is the right time, which is from first day onwards to 7th day. You can do a wonders to your patient. Okay, so that is the right time where the physiotherapy can be given to a patient and you can improve the quality of life of a patient. Okay, now many of you might think like there are chronic stages also when the patients are coming to us. Do we have a recovery in those stages? And maybe some false practices or wrong conceptions are there where people are saying in the chronic stroke or maybe after 6 months of time period, there is a redundant recovery. You cannot go for recovery for such patients, but that practice is wrong. Okay, we can go for even in a chronic stage which is more than 6 months of time period, we can look for recovery. Patient will show you recovery, but you have to give a right dose. Keep my words, you have to give a right dose of treatment, you have to give the right time of the treatment. Okay, for this whole graph we should understand the right time and right dose is very, very crucial. If you're giving in 1 to 7 days of time period, you can do a wonders to the life of a person. If unfortunately the person is still reaching to in a chronic stage, so don't worry, it's not wrong, you can give the treatment, but yes, the speed and you can say the rate of recovery might be decreased. Kam hoga usse, it will be reduced, but it will be there. Okay, so it's not like you can't help the patient, because medicine, this is the stage where your medicine is not going to help. So keep in mind, if someone is having a balance problem, someone is having a gait walking problem, that cannot be improved with the help of medicine. Is there any medicine which is improving the balance? No. Is there any medicine which is improving the walking capabilities of a person? No. Okay, so these are the problems which are only being addressed by the physiotherapist. Okay, and you know the numbers I have already showed you in the prevalence, the numbers of this problem is going to be huge in the coming 5 years or maybe in the coming future. Even today also the number is very high. So your need as a physiotherapist is a lot in the society. You just need to identify and you just need to give a right treatment and a right dose to your patients. Okay, so I hope you got some idea from this graph. So proceeding further, this slide is going to represent about a standardized assessment. This I have taken from evidence given by the Quackle 2017 article, where I have identified that they have very beautifully given some of the outcome measure tools which we should use. Because we are using, let's say we are treating a Parkinson patient, we are using so and so outcome measure. That is wrong. Okay, we are using a stroke outcome measure tools in a case of a Parkinson patient. That is wrong practice. So here, this is with the evidence. You can rely on this evidence if you want. You can just click a picture as well. So this is giving you idea that which scales you have to use. So I would suggest you guys that if the person is having a according to ICF classification, which is International Classification of Disability Health, according to that, if you are working on the body function and structure, I would suggest you should use a Fugel-Meyer scale. Fugel-Meyer scale is a good outcome measure tool if you're dealing for the arm or the leg movements of a patient. Now coming to second component, which is activity limitations. Here, walking. For walking, if you want to see after your intervention whether the walking has improved or not, so you should go with the 10-meter walk test. You know, I guess those who are with the stream, that is a kind of a test. You have to ask your patient to walk for so and so distance for a so and so time period. Okay, I'll not go into detail because I'm just giving you an outline in this lecture. As you know, that topic is very vast and the intervention also are very, very vast. So I'm giving you just superficial ideas right now. Third is the EQ-5D scale, which is called as the Euro Quality Scale, which is having a total 5 dimensions. Okay, so that is useful if you want to see whether the quality of life of a person has improved or not. Quality could be anything, like someone is sad and depressed, psychological issues, stress because of his own health issues. That is like he's not going out in the society and so problems. So you want to see after your intervention whether the person has improved or not. Right? So in that case, you can go for EQ-5D scale. And the last one, which is given, which is called as the Rankin scale. So this Rankin scale can also be used for the global disability concerns, right? Now, this is a very interesting part, I guess so. So this slide is going to explain us about what is happening to a patient of a stroke. Okay, to a patient of a stroke, what you can say the algorithms people are having, what they are thinking, what kind of recovery patient is going to have. So we all know the stage of recovery once your patient has suffered with this issue that I showed you the graph, if you remember. So the first will be the first day when the patient will be in a flaccid stage. Flaccid means there will be no tone in the body. Okay. So if I ask the patient to lift your hand up, though he will not be having even a tone capacity to take it up. So it will drop. So that is the flaccid tone. Means there is no tightness, there is no strength, if in a layman language I have to say. So that those are the words. If someone who is listening to me as an expert professional or maybe undergraduate student, so I guess you know very well, the flaccidity will be there in a patient in a very first phase where he will not be able to do any kind of movement. So patient movement nahi kar paega, there is no movement. And if he's not doing any kind of movement, you can look at the picture, what will happen to the patient. Maybe doctors are giving you medicine, okay, your brain condition will be fine or everything. But what about the limbs? You are not doing any movement because of your problem. Ultimately, there will be atrophy. Your muscles will get shrink. And you can see in the picture what is the meaning of this atrophy. And later on, God has given us this, you can say the blessings that automatically our body will go for recovery stage number 2. Okay, after some days, let's say 1 day or maybe 7 days, you will reach to a stage 2 where the tightness in the body will start coming. Okay, it is just a beginning of that tightness that will be coming in the stage 2. So means your patient is now able to do some kind of movements, but might be not optimal movements, but he is able to do something which he was not able to do earlier. So this is the phase which I try to correlate in a graph as a phase from where your orange line was starting. That is the phase when your patient, if you encounter or your patient encounter a physiotherapist, good physiotherapist who is giving a right treatment and right dosage, you can extremely, you can definitely you can change the life of a person to a very better quality of life. Proceeding further, next is the stage 3, which Brunstrom has given. So in this particular stage, we are expecting now patient is able to do some of the willing movements, voluntary movements, but not all the movements. So some of the voluntary movements patients can do, but it may not be a right movements. So if a very simple example, if I would be having a water bottle, or maybe I think you can't see that. So if I just pick up something and, but I'll pick it, take it to the mouth, but not in a right way like a normal persons are doing. That stage is the third stage. They will be able to do the movement, but there will be some tricky movements along with it. Okay. This is a very good slide for those who are a physiotherapist, or those who have done undergraduations, to differentiate among your patients and those who are seeking for master's program. Let's say patient came to you and you just want to identify your patient lies in which stage. Your patient lies in third stage, fourth stage, 5 or 6 stage of Brunstone. Simply ask three things to your patient. Ask your patient to take your hand at the back as depicted in the picture. So if your patient is able to do that, okay, it means your patient is proceeding towards stage 5. Okay, in a stage 4, your patient would not be able to do it much in a better way. He will find a difficulty in initiation, but he will be able to do at the end of that efforts. Okay, but in stage 3, your patient would not be able to take the arm in the position where like you're taking a wallet from your back pocket. So that movement your patient would not be able to do in a stage 3, but in a stage 4, your patient will able to do that movement, but with a lot of efforts. Okay. Next is you can ask during your assessment to your patient, okay, try to take your arm in a front or maybe as much as you can and try to go for supinations and pronation movements. Okay, so the just move up, palm up and down movements. So when you're asking the patient this movement and if he is able to do, then he is in stage 4. If he is not able to do, it means this patient is in the stage 3, which is a problematic stage. Okay. The third thing which you can ask your patient is, ask your patient to take your arm in a forward 90-degree of flexion. Okay. So if your patient is able to take the arm in a 90-degree of flexion, but not beyond that. So first, if it is able to take 90, then it means he is no more in a third stage, he is in a 4th stage. Okay. So 3 tests I have explained, which will help you to identify your patient is in which stage. That will help you for considering your protocol, what type of protocol we should give to the patient. I hope this slide will help to those who are dealing with the patients basically related to the stroke. Similarly, we are having certain concepts for lower limb also, but right now I'm focusing more on the upper limb. If definitely someone will be having a query for lower limb, they can contact me later on. So I'll explain the stage 4 for the lower limbs as well. Proceeding further quickly with the stage 5. So in the stage 5, the same 3 tests which I have mentioned, again, you have to go to the advanced level of those tests. Okay, so if you remember, I said you have to ask the patient to keep the arm in the front. This time in the stage 5, I have to ask the patient to keep the arm in the front though, but in a slightly more than 90-degree of movement. So if more than of 90, this is 90, if the person is able to do more than of 90, it means your patient is now entered into a stage 5, which is a good sign for you. Okay, that is a good sign for sure. If your patient, the second test now, if you will ask the patient again to take your arm at the backside, and if your patient is able to take the arm towards the backside, it means your patient, I mean the second test also, he has cleared. Third test is now ask the patient not in the front, but in the abduction, I mean into the horizontal sideway movement, and ask the patient from here, do the supinations and pronation movements. Okay, so in the abducted arm. If your patient is able to do this movement with elbow extended along with supination and pronations, that is the stage 5 of the patient. Okay, so I hope these 3 tricks will help you to identify whether your patient is in stage 3, stage 4, or in the stage 5, right? And there are similar kind of concepts for lower limb that I would like to address later if someone will be having a query. Okay, and finally we will reach to a stage of 6 where we can see the spasticity has been disappeared. Now patient is returning similar to a normal, but not exactly the normal, because we can find the patient will do the movements, but with the slight jerks or maybe some kind of robotic movements will be there in a patient. Okay, so that is the stage 6. It means your patient is towards the recovery, and that is a very, very good sign for you. And also please note, patients, every patient would not reach to stage 6. Some patients, as I said, there is a recovery window. So recovery window may stop at any stage. It may stop when they are at a very rigid tightness they are having in the body. Stage 3 only they can stop. So from there onwards, the physiotherapy is definitely required for their recovery. They cannot do themselves. They cannot improve themselves. Okay. All right, so this is all about the basics, which I have given you in a very short time, I think, but I have given you a very quick idea about the risk factors, prevalences, what is the rehabilitation, what are the different types of recoveries which are happening, the graph, which is telling us about the timelines from subacute, acute, and the chronic phases, and the Brainstorm stages and the recoveries, which we have just discussed. So now the next second section now of our lecture, which is towards physiotherapy interventions in the acute stroke. Okay, so the physiotherapy interventions in the acute stroke, I have mentioned two things over here. I hope people, those who know, they might be laughing now or maybe smiling. This is a smiley ball. People think the physiotherapy is about you just have to take a ball and just squeeze it. It will help you for improving the grip strengthening of a patient. No, that's a big no for this particular smiley ball, which is very cheaply available in the market. Although just because of its cost, everyone is asking like, take this ball and keep on practicing the exercises. I would suggest, please don't do it. This is a wrong practice. Okay, because when you're asking the patient for more of this flexion or shrinking activity, contraction activity, it will lead to more flexion synergy in a patient. Ultimately, the hand will go into flexion synergy. Then you cannot help the patient anymore. Okay, because hand recovery is the one which will be very much later in a life. I mean, you cannot do the recovery much to the hand because of the homunculus of the brain. Second picture, if you people can look at, that is, we sometimes are suggesting the patient, okay, you are having the left side of problem, okay, right side is fine. Hold your both the hands and try to take the hand in a overhead movements. Try to do that overhead movement, which is a common practice that physiotherapists are telling to the patient. Please avoid telling this to the patient in a very acute stage. I hope you know which one is acute stage now, as if you have attended this lecture or you heard me well. So you should not prescribe this overhead movements to the patient, although with the normal side to the affected side, because it may lead to some dislocations. Okay, don't do it in the acute phase of a patient. Now I have split the last second half of my lecture into acute and chronic stroke. Okay, so in the acute stroke, there are many approaches. I would not say approaches, it's a views. Every neuroscientist are giving a different views, their own concepts, and some mixing of the concepts of old therapies. But I have just outlined some of the very, very important one here. Okay, so the first one is splinting. The second one is positioning methods. Third one is partial weight bearing. Fourth is neurodevelopmental therapies, and the last one is the roots approach. Okay, I have nowhere mentioned about the passive movements right now. Okay, so we are having many things. If someone believes case physiotherapy walon ko, you just have to do the movements of upper limb and lower limb. No. Okay, please, it's a big no. We are having many things to be done in the acute phase, and because of the shortage of time, I'm not able to explain that much. But yes, I have given you the key points on my screen, that there are many things, even many more, which have not included over here. I have just included the evidences, which is giving me from moderate to a very good evidences. Only those I have included. Okay, so we'll go one by one with this. What is splinting? I think you know it better, and I've helped you with the picture. You can just look at the picture. So we are giving a splint just to give a stability to a person, and moreover to prevent the shortening of the muscle, because there will be, I said, in the stage 2, there will be a tightness in the body. So I need to prevent it. It will start from first day to 7th day onwards, right? So I need to stop initially. So initially, you should definitely prescribe the patient the splinting as per the need of your patient. Okay, so that there should not be any contractures, because once it is developed, it will take a lot of time to resolve the contracture issues. And splints should also be prescribed during the night, taking in consideration about the skin issues of the person. This picture is also very, very important if you are dealing patients in the ICU settings, or maybe in a ward settings. So please look at the picture. You should try in an acute phase to keep the elbow of the patient in an extended position, affected side. And you should also keep one, you can say the pillow placements or anything you can use, towel you can use. where the arm or the hand, the wrist should be in a slight extension with a slight flexion of the fingers. Okay, so that you know this is a glass holding position. So please maintain this position so that you can keep slight extension and you can keep a slight of the flexion of the fingers. So that is also depicted in the picture. Okay. The third one, which is very, very important over here, that is if your patient is in the ICU, you can look for the trunk rotations. If you can see in this female or in this patient, the right side is normal. Sorry, the left side is normal in this picture. So the left arm of the patient is now using it to reach to certain objects and take it back. Ultimately, it is helping the trunk of a person to go for rotation. So in a very early stage, patient is not now worried like I cannot do the movements. So you are teaching the patient to go for the truncal rotations in a very, very early phase. Okay, so this practice should be enhanced in your protocols. Next picture, if you can see, this is about forearm weight bearing, and now the person is simply eating something, maybe some food or whatever in the hospital setting, and at the same time, as a physiotherapist, you are keeping the hand of a person in a weight bearing position. You're not keeping it free, so your patient is in a weight bearing position, right? And that can also be promoted. It's a partial weight bearing that easily patient can understand, so that the proprioceptors of the hand will also work efficiently. All right. The next one, in the acute phase only, I have used some table. Okay, and that table may be moving up and down, so you have to maintain that balance, and the patient is putting a partial weight also on both the limbs. Okay, so that is one of the practice can be done not only for the upper limb like a previous picture. This practice is also for the lower limbs. Now patient is standing, hands are also moving. Along with that, patient is trying to move the pelvis and trying to maintain the balance. So this is called as your partial weight bearing along the bedside of the patient if his vitals are normal and if there is no IV line in a patient. Okay. Yes, this is also important thing. Femoral line, if especially the person is having any femoral arterial line, some tube are inserted there. So please don't go for the hip flexion of that person. And even the person is having a radial IV lines are there. So please don't ask the patient to go for flexion or extension movements. Ask the patient to keep the wrist in a neutral until the IV lines are there in the patient. Okay. Otherwise, you will have a you can say the issues with the medical staff over there. So please don't do hip flexion. Please don't do wrist flexions if there is a femoral line and if there is a radial line. You just see which line is there in your patient. Okay, so I have just given a very, very superficial outline about the acute phase. Now I'm proceeding with the chronic phase, what treatment options we people are having. So the very first thing, I divided it into two parts. If you can look at the first point, that stimulates the brain. Okay, so there is a first part which is stimulating the brain, some interventions which are stimulating the brain, for example, virtual reality. Okay, and the second is peripheral, facilitate the hemiparetic upper limb. So which is peripherally means outer side, it is helping your patient. Something which is stimulating the brain directly, something which is stimulating the periphery directly. So two different ways I have divided. So the first is body weight supported treadmill training. Second is virtual rehabilitation. Third is robotics. Fourth is constraint induced movement therapy. And the last one is the aquatic therapy. Okay, I think you have heard about the name. And if someone is a new person, this is what the physiotherapy is having. It's not only what you might be heard from the layman persons. So we are having lot many things in the physiotherapy which we are adding into our protocols when we are dealing with our patients, and also we are learning. So the very first thing which I am trying to just show over here, that is a body weight supported treadmill training, where we will be having a treadmill as the name depicting, plus we will be having a harness. Okay, you can look at the picture and you can see the harness. So around 30 to 40% of the weight of a person, let's say someone's weight is 80 kg. So 30 to 40% weight of that person will be lifted up by these harnesses. Okay, and rest of the weight the patient will do himself. So only the patients, those who are active, little bit those who are active, only those patients we will take to the body weight supported treadmill training. That you need to identify now which patient is fitting into this particular therapy. Okay, now once your patient has like okay with this kind of treatment, he is comfortable with it, then you can look at these three important points which I have mentioned, that is high intensity. या तो उसका intensity बढ़ा दो, like a speed of the treadmill that you can increase, or the weight support which you have given that can be reduced. Okay, apart from that, the repetitions, like earlier might be patient was doing it for 3 minutes, now you can improve it or you can extend it to 5 or 6 minutes. Last is the task oriented practice. Now give some task to a patient, okay, along with this therapy that can be included everywhere in every advanced approaches. Okay, so this is a very superficial idea about body weight support, where you have to give a 30 to 40% of support with the help of the harnesses, and lower limb of the patient should be active so that he can work on it, right? The second therapy which I have mentioned here, that is a virtual reality. One of the interesting therapy which I have also experienced, and I have treated many of the patients using this virtual reality. So it's like a gaming. It's not always required. You need to buy some Xbox, or you need to buy some advanced technique boxes or therapies or something like that. You can use a simple television also, or a screen, whatever is there at home, and you can add on maybe a cost of 3 or 4,000. You can add some kind of joy keys that you can use for in giving the intervention to your patients. Okay, if you are having a that this new technology, a well advanced box you are having, then it's your boon, like it's a benefit for you only. So we are having it's like a virtual games which you are playing, so you can use in 2-3 ways. One, with the specs, like there is a specialized glasses are available, so that can be given to the patient. Those are called as immersive methods. Or you can use the non-immersive method. Non-immersive may, if you can see this last picture where a person is not wearing any kind of specialized glasses, not 3D or 5D glasses. So without that, the person is doing. So this is a non-immersive method. Or if you can look at the first picture, here the person is doing with some eyeglasses. That is the immersive methods. Okay. And we can perform it for trunk. We can use for upper limbs. We can also use for lower limb. There will be a game the person has to do. It may be like a boating games. It may be like a, you have to hit something. So such kind of games are there, and ultimately it will help your patient to improve the balance because he will be incorporated into the game. Okay. The next advanced therapy, which can be used for chronic stroke as well, that is called as robotics training. So I have just pasted a one picture of robotics, but yes, even the full body exoskeletals, exogate skeletals we are having. So that can be used for the robotic training. Here I'm just giving you idea about the that the hand rehabilitation. So these kind of gloves, you can say these are available in the market also. If you belongs to India, there is an India Mart site where you can look for the prices of these products. Okay, and you can suggest your patient if they are okay with that financial expenditure. So then you can prescribe these things to your patients. This is one of my interesting thing, which I also like while practicing with the patient, that is constraint induced movement therapy. Constraint induced movement therapy, where you have to restrict the hand of a patient, and then which is the normal hand you will restrict. The side which is affected, you will ask the patient to do the movements with that side. Okay, so that is simply a constraint induced movement therapy. Here, it will be effective as per the evidence only if you are giving, let's say, 80% of the time of a day. I mean, it's huge, I know, but the therapy evidences are saying if you are giving for, let's say, 6 hours a day, you are constraining the hand of a person, which is a normal one, and you're asking the patient to use the abnormal side of the hand throughout the day for, or maybe for minimal 6 hours, then only it will be beneficial. Okay, so you need to look at the evidences when you are planning your protocol, whether it will benefit my patient, whether my patient will be comfortable with it or not, that you need to decide. And the last one here is the aquatic therapy. So aquatic therapy, you know, it's a hydrotherapy, which is also one of my favorite. I have a certification in this aquatic therapy also. It will help your patient because, you know, the water is having a buoyancy effect. So the buoyancy automatically will help the patient to go for for the movements. Let's say if you have to perform the knee flexion or extension. So with the force of the water, you can adjust your patient, and that buoyancy will help your patient to go for extensions. Let's say here only in this picture, your patient has to do the knee extension. So the buoyancy is giving you a pressure upward. Okay. So automatically it will assist the patient to go for knee extension if the knee is underneath the water. Okay. So likewise, hip extensions, knee flexions, lot many movements you can perform inside the water, and it will help your patient. It will assist your patient 50%, and he will be more confident, like now I can do the movements. So sometime with the, because your therapy might be a monotonous on some day, for because these patients are seeking a help for 6 months or maybe more than that. So you need to keep on changing your protocols as per the need of a person, right? So this is all about the advanced therapies which I have mentioned. But yes, there are a lot many more interventions which I can also talk about. But I guess this much is sufficient for today's lecture. And the last is the summary. So what we have discussed, purpose of rehabilitation is to regain our patient's ability as much as possible, make them independent as much as possible, which cannot be done with the medicine and with the physiotherapy. And we have to do a lot of practice and repetition of the task. And that are the only facilitators to recovery. Okay. So, and the last is, I always say to my students as well, we as a physiotherapist are working as a magicians, this magic is not for just for a 2 seconds or a 1 second. This magic is going to be lasting for a lifetime of a person. Okay. So you can do the magic with your hands. So that is what we need, and we need to learn more. And physiotherapy definitely is the future of our society. So I would request the people, if you are I mean, you are having a more interest in physiotherapy, so please go for master's programs as well in the future. All right. So thank you so much, everyone. Over to you, ma'am.
Yeah, thank you so much, ma'am. First of all, for presenting this presentation and giving a virtual live, I'd say, explanation as to how one can actually stay fit whilst doing a physiotherapy. And a special vote of thanks of the time that you've credited, the experience you've given, and the knowledge you've given through the session. So thank you so much for this, ma'am. And yeah, and now, ma'am, I'd like to take up some questions that we've had from our attendees. So with your permission, can I take that? Okay.
Yes, please, ma'am.
Ma'am, this question came from Radha Sharma, first question, and it read, do we need to have any diet changes also while having any physiotherapy?
Yes, if the person has already suffered with a stroke, then also, and if the person has not suffered with a stroke, but there is a probability the person may suffer in future. So we definitely need to look at the diets. Might be a controversy here, but yes, there is an article or evidence which is suggesting that if you are a heavy non-vegetarian diet, if you are taking heavy, not a normal one. Okay. So I'm keeping myself safe from that controversy also. So if you are having a heavy non-veg diet, it may also lead to a stroke. But if you are having a normal non-veg and a vegetarian diet, it will prevent you from the stroke. Okay. So anything which is increasing your cholesterol is one of a risk factor for the stroke. Okay. So there are a lot many risk factors. So definitely you need to look at your diet.
Okay, ma'am, thank you so much. And I agree with the point that you've given, though it was not controversial. I think it has, there are many researches that has already been done.
Yes.
So, yeah. And with this, ma'am, I would like to take second question from Ishani Hilal. And it says, can physiotherapy be helpful in treating cervical pain also? I think it is very common in today's generation now.
Yeah, cervical pain is one of the commonest one from the very younger, like all of you, and even me in the middle age, or maybe the elder one. Everyone is suffering with the cervical issues, and physiotherapy is one of the benefit. Like it will give you an instant recovery, because stroke is not giving instant here. Because I said it, you need a 3 to 6 months. But yes, for cervical, definitely the physiotherapy will help you. If you're not encountering anyone, you can come across an LPU, and we'll definitely treat you for that.
Okay. And before I move to last question that we have here, I'd like to request to all the participants, if you have any other question, you can directly post in Q&A box or chat box, or we can allow you to talk to our expert directly if you write your question or raise your hand. So, ma'am, with this, I'd like to take this last question. Okay, this question is, I think, a little controversial, and it says, physiotherapy is quite expensive. So can you suggest any general exercise that we can help to keep ourselves fit?
Yes. Let's say physiotherapy is expensive. I'm not sure about this, but yes, it depends upon the conditions. Okay, if someone is having a head injury, someone is having a spinal cord injury, or someone is having a stroke, okay, then might be it might be expensive. Okay, and if similarly, if you're going to a doctor, you are having a fracture, it will be expensive to you, right? So if there is no such issues, you have to work on the diet first of all. Second, on the mental piece, which is very much required from the COVID, I guess. That era we can understand, the mental piece is very much required. So please be mentally stable. Don't overreact for the things. Try to change your lifestyle. Don't work on the mayonnaise and other products. We are just consuming all these things on everyday basis, so we should definitely work on that. And plus, the morning walk is the best to decrease your blood pressure. Those, even your mothers or parents, if someone is having a high blood pressure, I would definitely recommend you, because this is the study I've done recently on my parents too. Those who were walking in the morning, their blood pressure has been reduced to a very great level. Okay, so please start your morning walks. It's just not so boring, it's so interesting. So please try once. Okay, and do for diet changes. Okay,
I
thank you.
definitely agree. And I would just request or maybe recommend to have any companion that you can have whilst having this morning walk. You love it. So, okay, we have a question coming in from Arya Chatterjee. What is the reference? Which book of those three tests for stage 3, 4, and 5 brainstorm recovery, ma'am?
Okay, the book name is Brainstorm itself, and this book is quite costly. Luckily, I got this book from someone, from my senior though. So I have that book, Arya. If you want that book, you can ask me. I'll give you that printout. That book is not available online. That is a Brainstorm's original book. Okay, it's
And
around, yeah,
Arya,
it's.
like you to kindly visit our campus as well to have a chat with a ma'am, and then you can just directly get from your teacher or expert in here. So if there's anyone who want to give your question, queries, or thought about physiotherapy, you're most welcome to write in the chat box and Q&A box. And ma'am, before, I mean, while they write the questions in here, I'd like to show them a little about the site as well, the admission process, how they can take admission. So
All
with
right.
your permission, yeah, okay.
Yes,
Okay.
ma'am.
Okay. To all the questions that we've had regarding admissions, as to how you can take admission in a particular course and what you need to do, where you need to go. For this, I would be just giving you one short resolution. And for this, I will be sharing my screen. And my screen is here. Okay. I hope my screen is visible to all of you. Okay. Now this is gonna be this one short resolution for everyone who wants to take part or who wants to take admission in lovely professional university. That is this site lpu.in. lpu.in would be the site which you need to just confirm in your browser, and after that this will be the interface that will be coming in front of you. Now we're catering about admission queries, right? So we simply click on the admissions in here, and when we simply click on the admissions, we will be seeing all the segregated courses that we have. You can see after 12th, after graduation, post graduation, 10th, doctoral, diploma, etc. So now we're going to take a little example of, let's say you are a 12th passed out and you're an undergraduate student and want to take part in a regular program, right? So you simply click on undergraduate programs and regular, and there are a whole lot of disciplines you can see in here. Every discipline, you name any discipline that you want to name, and we have all of them. So I'll be just naming some of them, and then so you can see engineering, management, law, pharmaceutical sciences, economics, architecture, design, films, arts, every other discipline as well. Now, since we were talking a lot about physiotherapy today, why not take an example of the same? So I will just simply click on physiotherapy, and we have the program that is offered under that particular discipline. We have Bachelor's of Physiotherapy, that's called BPT. I think most of you would be knowing this. Now, once I click on this program, there are all the details of the programs. Okay, now I'll be just, yeah, so basically we have all these options, and I'll be just briefing you these options in the next 1 minute. So this program detail gives you the eligibility of the course, whether you are eligible for a particular course or not. This program detail will be giving you that. Highlight, right? So this highlight gives you all the researches that has been done, all the achievements that our students has done, all the placements, rankings that a university has. Now is the fee. A very much important part for students is the fee structure. You can see our fee is 80,000 per semester, but again, this is not something our students do pay usually. Why? Because they get a lot of scholarships. On what basis? These are those bases. We have 3 categories of the scholarship, and these are the bases. And if you avail category 1, and if you are able to get the category 1, you can avail up to 48% of program fee waiver, and your fee will be reduced to 41,600 from 80,000 per semester. Right now, I'd like to take your attention to other scholarships as well. We have scholarships based on NEET and other special scholarships like entrepreneur. You are a student port topper, or and if you have been a sports in sports or cultural or maybe co-cultural or social services, then we offer you the scholarships. And we also have some financial aids as well, so you can just simply click on that, and you can just check whether you're eligible for that or not, and you can simply apply for the scholarship. Now is very important part of this webinar. Today is the last date of admission, that is 31st May 2023. So students, it's just not too far now, just 4 to 5 days from now, 31st May, right? So I would urge you to kindly apply for the test, apply for the course that you would want to take. Now, how you can apply is something that I'm going to tell you in here. So simply click on apply now, and these are the options. You can see bare minimum requirements that will be asked, and after that you'll be given your dashboard, and once you will be given your dashboard, you can simply apply. So I hope that I've given you a little idea as to how you can take admission in a particular course that you want to. Now, if I could not address anything, you can simply write in the Q&A box, or you can simply schedule a call. You can WhatsApp us or have a live video counseling session as well. Now, last but not the least are the numbers I'm going to provide you. You can call on these numbers. These numbers are counselors' numbers. You can call on these numbers, and we will be here to resolve your problems, to resolve your queries. And if you have any kind of query regarding admission, regarding course, regarding eligibility, scholarship, etc., you can simply call on the numbers that I'd shown. So now with this, I'd like I'm just requesting everyone, if you have any other question, you can post in Q&A box, and if not, then I'd like to take permission from all the participants and our expert Manju ma'am to wrap this webinar up, if she doesn't want to add anything. Okay, I believe there are no queries in here. So I'd like to thank you, ma'am, for coming in, for giving your time, for giving your knowledge value for us, for students, for me as well. And I hope that students have enjoyed this session thoroughly, like I was enjoying. And I also want to thank to all the participants for being here, for being so much patient with us. And the questions that you've put is really appreciated. So until next webinar, stay safe, stay healthy, and kindly explore our site, that is lpu.in. And there is a page of webinars as well. So I will be just posting a link for that just in a moment. So this is the link that you can okay, just in a moment. Yeah, so this is going to be the link. You can simply apply. I mean, you can simply register here. These all the webinars that you see on this site will be free, right? You can register in whichever webinar you feel you want to take knowledge from, right? And this is the site that you can just explore. So, okay, then thank you so much for joining in, attendees. So meet you soon in the next webinar, and until then, stay safe and stay healthy.
Thank you.